Hello, everybody. Dr. Torres here. I wanted to take a few minutes to go over a presentation about how something called mindfulness can help us to prevent burnout in healthcare. This is a very important topic because it has to do with our career and the longevity in our career and how we care for each other and our patients. I hope that you find this meaningful. So, what is burnout? Burnout is more than just feeling tired. It's a state of emotional, physical, and mental exhaustion caused by prolonged stress. It often shows up as emotional exhaustion, where you feel drained and overwhelmed. Then you get something called depersonalization, where your interactions with patients start to feel detached and indifferent. And then you get a reduced sense of accomplishment at work, and where your work feels less meaningful. But burnout doesn't just affect how we feel, it changes how we engage with our tasks and with our patients. Recognizing the signs of burnout is the first step towards preventing it. So let's take a closer look at burnout. The American Medical Association does what is called an organizational biopsy survey. They do this every few years, and they have discovered that between 1 and 5 years after you start training, already the rate of burnout in healthcare workers is about 46%. By the time you're between 6 and 15 years into your practice, if it peaks about 55% of healthcare workers are burnt out. And later, over 20 years in a career, it tends to decrease. So it's a significant amount of healthcare workers that are experiencing burnout. So, what are the common causes of burnout in healthcare? Number one, you can have a situation in which you're working quite a bit, long hours, continuous patient care demands with insufficient breaks. You can also have emotional strain, exposure to a lot of suffering, critical care of patients, difficult patient outcomes. You can also have lack of control and minimal autonomy in decision making or in the work processes. Limited staffing, equipment, or support. Sometimes it's the work-life balance that gets in the way, struggling to maintain personal well-being and relationships outside of work. The important takeaway of this is that if we understand these levers that affect burnout, then we can figure out which one of those we can manipulate to decrease burnout or stop burnout. I really like this slide because it shows what happens when you get burnt out. So on one axis is the quality of our performance, and the other one is the level of stress that we experience. So on the left side, for example, if we're working in an ER that only sees just a few patients, we're going to be bored, we're going to lose our skills. And then on the right side, if you work in an ER where it's just completely overwhelmed all the time, everybody's holding admissions, there's patients everywhere, and it's chaos, then there's going to be increased exhaustion, threat, anxiety, and burnout. The thing I like about Emeris is that we are in the meaty part of the curve. We're in a situation where we can actually spend more time with patients. We are able to have a closer relationship with them. And for being a micro hospital, we have fantastic support. I really think, and I feel very lucky to be working in this type of environment because I have been on the other sides of the spectrum and it's no fun being there. So how can we use mindfulness to prevent burnout? Mindfulness involves maintaining personal awareness of the present moment without judgment, helping us manage stress and emotional exhaustion. Some of the techniques that I use during my shifts are, for example, focused breathing. If I find out that I'm becoming emotionally upset or stressed out, I can slow down my breaths, and that sends a signal to my nervous system to reduce anxiety. I can also do what I call body scans. I can notice if my shoulders are tightening, if my blood pressure is going up, if I'm getting upset or frustrated. And that awareness helps me once again reduce anxiety and realizing what is happening. You can have short meditations before a shift or during your break, 5 to 10 minutes, to enhance focus and reduce stress. You can do mindful movement during your break, taking 30 seconds to walk or stretch and becoming grounded and having full awareness of your body and your surroundings. You can also do gratitude journaling, or just not even necessarily writing it down, but just being grateful before a shift, for example, for the fact that we work in small teams in a more intimate environment where we can take care of patients and have a bigger impact because of that closeness. There's a lot of research on mindfulness-based stress reduction and how it lowers emotional exhaustion and it boosts our empathy towards our patients, and how mindfulness interventions help us to prevent burnout in the healthcare setting. One of the biggest sources of frustration is that we forget that there is an asymmetry between the patient-provider relationship. What do I mean by that? As providers, we have a knowledge advantage. The patients depend on us to guide them through a complex healthcare system. Many patients experience fear and distrust from past experiences or healthcare disparities, discrimination, or just system failures that contribute to them being hesitant or distrustful. The other thing is that professionalism requires us to be equitable and provide equal care to patients regardless of their background. Our duty is to ensure that each patient receives unbiased, high-quality care regardless of their background. So it is really not fair to expect the patient to have the level of medical knowledge and understanding that we have. So let's go over some examples that I have seen in my practice of frustrations that kind of rise out of this asymmetric medical knowledge. I'm sure you've heard some of these. For example, the first one, why did the patient come here? She just had surgery at that other hospital. Well, the patient called her surgeon and it was after hours, and the message just tells them to go to the ER. They do not understand sometimes how the medical system works. This other one, I can't believe they did not give their kid anything for their fever. Well, the parents thought if they treated the fever, the staff would not be able to accurately diagnose the child. Once again, they just do not have sometimes the medical knowledge and understanding that you do. The next one, well, she is here for constipation at 3 a.m. Why don't people think before coming in? The patient thought that her pain was from constipation, and it actually ended up being a case of perforated diverticulitis. So don't get frustrated when people say something. Just be unbiased, do the workup, get the history, because it might end up being something completely different. The next one, why can't people just take an over-the-counter COVID or flu test or medication? Well, it turns out that many patients find pharmacy medicines confusing, often due to factors like complex medical terminology on labels, a lot of medications with similar names, etc. This can lead to misunderstanding about their medication usage, or just simply not be familiar with what things are available over the counter. So we have a decision to make. You can choose to accept that your patients are human. They're imperfect, unpredictable, and sometimes flawed in their decisions, or you can resist that reality, allowing frustration to consume you and creating unnecessary stress and emotional exhaustion for yourself. So mindfulness teaches us that sometimes we have to surrender control to find peace, especially in a healthcare environment where we work with people. One of the biggest sources of frustration in healthcare is worrying about things that you cannot control. For example, you cannot control how someone else behaves, but you can control how you react. You cannot control which patients show up, or at what time of day they show up, or why they showed up in your emergency department. The answer to why are they here is that they walked through the door. When you start to worry about things that you can't control, start to step back and focus on what you can control. Focus on your actions, your outlook, your communication. You can control how you act, how you think, and how you communicate. Let go of things that you just cannot control. Here is where mindfulness is very useful. Before we finish, I'd like to share some mindfulness insights from an author called Eckhart Tolle. Tolle teaches us that true peace comes from living in the present moment, freeing us from unnecessary worry and stress. In a high-pressure environment like the ER, it is easy to become trapped in what is called a negative thought loop or overwhelmed by job demands. He invites us to have an approach that helps to shift the focus from these negative reactive emotions to calm, neutral awareness. And that is how we can reduce stress and enhance emotional resilience. This is a key insight that I want you to think about. The primary cause of unhappiness is never the situation, but your thoughts about it. Be aware of the thoughts you are thinking. Separate them from the situation. I used to work with a friend of mine who was a nurse, and fantastic clinical nurse. He would come in the morning, and after every patient encounter, you can just see him become frustrated about things that he could not control. By the middle of the shift, he was just upset and burnt out. I was in the same environment that he was seeing, but my reaction was, it is what it is. I cannot control who's showing up or what they're saying, but I can control how I react to it. So he would be really upset and I would not be upset. And this is what has helped me to have a career that I enjoy and that will last longer without burnout. So how do we apply this to healthcare? Stay present with your patients, fully engage in each interaction instead of anticipating the next task. Detach from outcomes, focus on the process of care, not on results that are beyond your control. Recognize those thought patterns, acknowledge stress and emotions, and don't let them define your response during your shift. Anyways, by cultivating this mindful presence as healthcare professionals, we can enhance both the patient care and our personal well-being. And finally, I'd like to turn your attention to your personal identity as a healthcare worker. Just keep in mind that big picture perspective. At the end of your life, I want you to be able to look back and truly say, I lived as a healer. A life dedicated to service creates fulfillment that goes beyond the tasks that we do every day. It touches lives, it heals hearts, it contributes to something greater than us. Embracing this identity of a healer becomes a legacy of compassion and care that continues to ripple outward in our communities. Embrace that healer's role. You may not be able to cure everything, but you can always allay anxiety. You can always communicate and educate and have this personal interaction with patients that is very unique and a privilege. Viewing yourself as a part of a larger continuum of care fosters purpose, connecting your daily task to a mission of alleviating suffering. Having resilience by reducing your frustration and emotional burnout, keeping in mind that bigger picture. Also, your legacy, your work impacts not only individuals, but also communities, as we discussed. And finally, the benefits of having this broader view is that increases our fulfillment, is a deeper connection and increased satisfaction with what we do for a living. It reduces our frustration and diminishes worry. I just want to thank you for choosing this career. Just remember that what you do matters. And remember also that you are the most important patient that you have.